this PowerPoint, intravenous therapy and blood transfusion. Intravenous therapy and blood transfusion is important for nursing NCLEX board exam. If I ask you, why are the IV fluid used? So IV fluid we use through the intravenous therapy. Intravenous therapy, we say. So intravenous therapy, why we use the intravenous therapy? What are the purpose and what are the indication or use for? So keep in mind, intravenous therapy, they are a very quick way to replace the nutrient, the water and electrolyte in the body. Let me recap it. I said why we use intravenous therapy. So they are a quick way to replace the nutrient, water, and electrolyte. So let me read it. Used to sustain client who are unable to take substance orally, then we give intravenous therapy. Replace water, electrolyte, or nutrient more rapidly than oral administration. Provide immediate access to the vascular system for rapid delivery or specific solution without the time required for gastrointestinal tract absorption. Intravenous therapy also provide a vascular route for administration of medication or blood component, right? So like I said, replacement of water or electrolyte. So what are the type of liquid we replace? We called IV fluid, like isotonic, hypotonic, or hypertonic solution or fluid we supposed to use. So sometime NCLEX would ask, if your patient undergo the intravenous therapy, what we could monitor closely, or why should intravenous fluid be closely monitored? Because a rapid increase in the fluid shifting into the cell can cause cellular or cerebral edema. So it is important to monitor your patient. So now let me go the second page. They said the type of solution, right? Keep in mind, 3 types of IV fluid or solution we use, right? One is isotonic, one is hypotonic, other is hypertonic. Let me explain them a little bit. So, first of all, if I tell me something about isotonic fluid or give some example. Isotonic fluid is the same as inside that cell, usually 0.9% normal saline or lactate ringer, or we called dextrose 5% in water, is the isotonic, right? Keep in mind, why you give isotonic fluid to your patient. When patient has a diabetic complication like we call DKA or diabetic ketoacidosis, we give them isotonic solution. Or when patient undergo burn, or when need to replace the sodium and chloride, we chose isotonic solution, or 0.9% normal saline, right? And 0.9% normal saline always hang with blood transfusion as well. Let me read it first. The picture, you can see the sodium chloride, 0.9% sodium chloride. So isotonic have the same osmolarity as body fluid, increase the extracellular fluid volume, and do not enter the cells because no osmotic force exit to the shift of the fluid, right? So as I told you, the major indication of isotonic fluid, basically we use for diabetic complication, we use for burn patient, to replace the sodium and chloride, and also 0.9% sodium normal saline always hang with blood transfusion. The next fluid here, hypotonic solution. So the nature of hypotonic solution or fluid, hypotonic fluid is less concentrated than the cell, and this would cause water to move into the cell. Usually 0.45% normal saline is an example of hypotonic solution. The common indication of hypotonic solution we use for dehydration, hypernatremia, or lower blood pressure, right? Let me read it. Hypotonic solution are more dilute solution and have a lower osmolarity than body fluid, and cause the movement of water into the cell by osmosis, and should be administered slowly to prevent cellular edema, right? Imagine your patient need to take hypotonic solution. So if your patient need to take hypotonic solution, what should closely monitor? Why we need to monitor also? We need to monitor because a rapid increase in fluid shifting into the cell can cause cellular or cerebral edema. Now next here, hypertonic solution. So hypertonic solution is more concentrated than the cell. And this would cause water movement out of the cell. The common hypertonic solution we use 5% normal saline or dextrose 5% in normal saline or dextrose 5% in lactate ringer solution. So what medical condition or why should you give hypertonic solution? We give if patient have hyponatremia or if patient need nutrition. We choose the hypertonic solution. Let me read it. Hypertonic solution are more concentrated solution and have a higher osmolarity than body fluid and causes the movement of water from cell into the extracellular fluid by osmosis. So next here, why should the fluid be closely monitored if your patient need hypertonic solution? We need to monitor because it can cause electrolyte imbalance and it can cause dehydration. Before you start IV fluid, we have to assessment our patient. What we should assess? We have to make sure the patient intravenous line is patent or okay. If the IV is infiltrated, what would we see? Usually we see the cold, swollen, tender, or painful at the site. Now let me go next. Here, that another type of solution we use, and that is called colloid, right? And also here, another type is called colloid. So what is colloid? So colloid is also called plasma expander. Sometimes in some medical condition, we need to give the patient only the colloid, not other things, right? So also called plasma expander. On pull the fluid from interstitial compartment into the vascular compartment. So first of all, colloid is called plasma expander. What is plasma expander? Example. So we know we have a blood in the body. So blood basically contained corpuscle. So corpuscle or contain the, or other name is called blood cell. Blood cell. Example, RBC, WBC, or platelet. But blood also contains the liquid. And this liquid actually water. And this is called plasma, right? Plasma. Where the red blood cell, white blood cell, platelet, nutrient, protein, albumin is floating, transported, and carried, right? So if you remove all corpuscle, the remaining liquid portion, watery portion is called plasma. So colloid we use as a plasma replacement. It is called plasma expander. Also, pull the fluid from interstitial compartment into the vascular compartment, used to increase the vascular volume rapidly, such as hemorrhage or severe hypovolemia. So if the patient have severe bleeding, if you do not stop the bleeding, patient develop hypovolemia. And hypovolemia, if you do not stop, patient develop the blood pressure go down. When blood pressure go down, I said hemorrhage means bleeding. When hemorrhage continue, it lead to blood loss, and blood loss leads to the hypovolemia, and hypovolemia lead to the hypotension, and hypotension lead to the low blood pressure, and low blood pressure lead to the shock, right? Hypovolemic shock. And this hypovolemic shock lead to the death. So what else? Sometimes when you go to the prioritization question, which patient you have to check first, we called A, B, C, D, lost. A stand for we have to check the airway first, right? Airway. Then we have to check the breathing, right? We have to check the breath. Then you have to check the circulation, or we have to check the any active bleeding. So this active bleeding actually hemorrhage. If you do not stop, lead to the hypovolemia. Hypovolemia lead to the hypotension, and hypotension lead to the shock, and patient die. So now let me go next here. So administered often intravenous solution or medication provide immediate access to the vascular system. And this is a benefit of administering solution or medication via this route. What is route? IV route. Because this route, medication, they are very quick way to replace the fluid or nutrient or water or electrolyte. Therefore, it is critical to ensure that the healthcare providers' prescriptions are checked very carefully, and correct solution and medication is administered as prescribed. So why we need to monitor? Because if you do not monitor, or if you rapidly replace the fluid, it can cause different problem. Example, rapidly increase the fluid shifting into the cell can lead to the edema, right? So before admin IV fluid, always follow the 6 right for medication administration. Here is is a short review about the different kind of solution what I already explained. So they had said type of solution and their uses. 9% normal saline, lactate ringes solution, 5% dextrose in aqua or water, 5% dextrose in 0.22% saline, 5% dextrose in 0.9% normal saline, 5% dextrose in 4.5% saline, and 5% dextrose in Ringer's lactate solution. So we categorized this solution according to the tonicity. Like 0.9% saline is an isotonic on base of tonicity. What is tonicity? Tonicity means the concentration of solution or number of dissolved particles in the IV solution. And this is always compared to the intravenous fluid. So isotonic, which one? Normal saline. So the nature of isotonic means the tonicity or concentration of dissolved particles is always same to the intracellular fluid. So keep in mind, isotonic solution we use if patient have dehydration, if patient is shocked, or if patient need fluid volume replace, or if the patient has a fluid volume deficit, we give them isotonic solution. If your patient need increase the blood pressure, you give them isotonic. Another common question NCLEX board asks, if your patient need blood transfusion, you need isotonic. So a company of blood transfusion, we need isotonic, right? Or 0.9% normal saline always hang with blood transfusion. Common question NCLEX board asks. Now here, example, 5% dextrose in 0.9% saline, it is called hypertonic. So hypertonic means tonicity is greater than intracellular fluid, and this will causes the water is moved out of the cell and causing the cell to shrink. The hypertonic solution never give the hypertonic fluid to the patient that are dehydrated, never give. Example like DKA, never give. So what next? Here showing the picture, different kind of IV solution come in a variety of bag size volumes, 50 ml, 250 ml, 500, and 1000 ml. Here showing different cannula. What are the different cannula we use?